Welcome back. I recently gave a presentation to a local school of pharmacy covering various residency topics from why one should pursue residency training, what a highly competitive CV looks like for a pharmacy residency candidate, as well as what a typical day looks like for a pharmacy resident. So I just want to take some time to go over a couple of those slides that I presented, and hopefully all you pharmacy students and residents out there find some type of value in this presentation. So without further ado, let's head on over to PowerPoint. Welcome back, everybody. So like I said in the introduction here, we're going to go over some of those slides that I presented at that local school of pharmacy. Some of the objectives we're going to go over include describing reasons one would or should pursue residency training, identify criteria of a highly competitive CV, list items of importance of a residency candidate's application with regards to offering a residency interview, as well as summarizing key elements to successful interviewing. So first, I wanted to give a little bit of background on personal experience so everybody knows where I'm coming from. I did complete a accredited PGY1 pharmacy residency. I then went on to complete an accredited PGY2 critical care residency, and now currently I am a PGY1 RPD as well as critical care clinical pharmacy specialist. First, I think it's important to go over what the main accrediting body for pharmacy residency programs discusses with regards to residency training. So ASHP has something called their PAI 2030, which is their Practice Advancement Initiative 2030. And this is a document that you can go to ASHP's website and look further into, but basically it covers 59 recommendations on the optimal, safe, and effective medication use. And within one of those themes under organization focus, as you can see here, B4, health systems should require completion of ASHP accredited residency training as a minimum credential for new pharmacist practitioners. So obviously the main accrediting body is pushing for basically residency training being a baseline requirement. Other reasons one might want to pursue residency training include obtaining leadership and clinical skills in a condensed time period. So obviously you rotate through a lot of different experiences throughout your residency training. So you do obtain a lot of different types of leadership and clinical skills. It gives you or can give you a competitive advantage in the job market. So one of the things that students and residents should be doing is really seeing how they can separate themselves from everybody else, whether that be residency training or being involved in student clubs or publishing. Residency training also could help with networking opportunities. You can find mentors as well as expand your resource base. And pharmacy residency training can help you achieve your professional goals. So if you have professional goals of working in a specific area of practice, such as cardiology or infectious diseases, residency training can definitely help you get there. First, we'll discuss someone's CV. So in general, my thoughts are that a CV should definitely be formatted in a way that is neat and organized. And it really doesn't contain any extra information that doesn't pertain to pharmacy practice. So it's a concise CV. I think it's also important that everybody is aware of some of the resources that are available to them regarding CVs. And one such resource is ASHP CV Development. They do have a CV review program where you can submit your CV, and then those are submitted to volunteer reviewers so you can get some feedback. They also talk about some of the traditional CV components, as well as ASHP does have a CV transition toolkit. So when you're transitioning from maybe a student to a resident or a resident to a professional position, they'll discuss ways that you can transition or change or alter your CV to definitely factor that change in. The American College of Clinical Pharmacy also has on-demand CV services. So just like ASHP, you could submit your CV for review. On their website, they do have sample student CVs. They discuss everything from CV pearls to CV turnoffs. So with regards to residency candidate applications, I think it's important that students are aware of what pharmacy residency programs get when somebody does apply to the residency program. So I'm going to talk about those main components. And those include 3 references. I always tell students or residents to be strategic with who they ask to complete a reference for them. Make sure it's somebody that knows them well and can speak to their strengths. The forecast standardized template, when these references come in, they'll go over, there's a spot on those standardized templates to discuss everything from their writing and communication skills to assertiveness to your strengths, as well as areas of improvement. Another component of a pharmacy candidate application is the personal statement or letter of intent, basically outlining why you're applying to the specific residency program, maybe what your interests are, just really discussing kind of your thoughts, feelings, your personal backgrounds, and why you would be a good fit for that residency program. So make sure you refer to the specific residency program you're applying to, their site, and see what they would like, or if they give any type of information on what they would like included in their letter of intent. Of course, the CV is part of this application, as well as school transcripts. So when I'm reviewing residency candidate applications, there's a couple things that I kind of gravitate towards too, and many different programs may have different methods. But when I kind of look at a CV, I do look at a GPA. Some institutions, if they do get a lot of candidates, they may have a GPA cutoff. I definitely see if there's some type of hospital work experience with the student. Now, I know at the same time that a lot of pharmacy intern positions within an institution are limited in a specific area, but it's nice to know that maybe a student kind of has shown some initiative to get an intern position. But you also want to make sure that if you do match with a student, that the pharmacy workplace inpatient setting is not going to be foreign to them. I also like to look at their personal statement or their letter of intent. I just want to make sure that the interests that the candidate displays in their personal statement is something that we can offer as a residency program, and something that we can help achieve their goals. I also do take a look at their APPE rotations, just kind of get an idea of what APPE rotations they had, maybe try to get an idea of how challenging they were or not. So I just kind of like to see if also their interests are somehow associated with their APPE rotations. I always like to see if students have the ability to seek out a specific rotation that they can do, and they can kind of steer the direction of what rotations that they undergo in their 4th year. Also kind of look for involvement, not just membership in student organizations, such as the Student Society of Health's SSHP. And then, of course, I review the references and see what the references are saying about them. With regards to residency interviews, I definitely recommend that you're on time. Professional attire, of course, is worn. The candidate is able to communicate effectively. With in-person or virtual interviews, there's a few distractions, whether it be verbal or non-verbal distractions, as well as how the candidate performs and answers the performance-based interview questions too. So I definitely recommend everyone be ready to answer some of those questions, those performance-based interview questions. So do a search on that and see how you can answer them. And a lot of those questions entail really, we try to weed out if you have, what your time management skills are or conflict resolution. Tell us about a time when you had multiple projects. What was the specific situation? How did you organize the work? Was everything done on time? Or like I mentioned with conflict resolution, was there any time when you had some type of conflict with a coworker? What was the specific situation? How did you handle that situation? And looking back, what would be better? So definitely urge everyone to practice those. The idea is that, past performance might be some type of predictor of future performance. So again, I think it's important that everyone is aware of the resources they have available to them. ASHP does have an interview skills packet. They outline common interview questions, questions that are residency specific, questions regarding clinical experiences, their leadership experiences, as well as, like I mentioned before, conflict resolution. The ASHP also does have virtual interview tips. With a lot of things more virtual nowadays, they do discuss various topics as professional attire. So even though it's a virtual interview, basically wear professional attire that you would wear in an in-person interview, as well as make sure you're paying attention to the background of your virtual interview. They actually go into a lot of detail too, as far as the headphones too, whether it's wireless headset or a wired headset, how large they should be or not, as well as the camera angle too. So very detailed information and resources available online. Another topic I discussed too when I was at the school was a typical day of a pharmacy resident, and really it depends on the rotation the resident is on. Now, of course, I can discuss really a typical day for a resident during my critical care rotation. And so, a typical critical care rotation is, the student or the resident would have to come in early enough that they would be prepared for rounds. So, of course, look up pertinent patient information. Make sure they go ahead and take care of any of the specific clinical consults, or if there are any levels that need to be taken care of right away. And then, depending upon where we're at with the rotation too, pre-rounding with the preceptor, then rounding with the medical team, lunch after that, finish up clinical consults, whether it be vancomycin, aminoglycosides, anticoagulation monitoring, or TPN monitoring. And then really my expectations for residents are that if there are any other resident or student presentations, that they are present and they are actively involved with that. Maybe we would have a topic discussion after lunch, finishing up clinical consults like I mentioned, any other projects, assignments, or topic discussions. So really, being a resident too, it's important that you put your time management skills and you're able to prioritize your work. So with the virtual ASHP Midyear Clinical Meeting coming up here, I think it's important. Another resource online is the National Matching Services. So of course this contains information regarding the pharmacy residency match, as well as key dates, as far as registration for the match, early commitment processes for PGY2 programs, specific dates for when the Phase 1 rank order list deadline is due. On this website too, they do have an example matching algorithm too. So if you want to know more information on how the pharmacy residency match works, they do have a video on that, very detailed, and I believe you can also run a test match on the website as well. So with that being said, like I mentioned already, the ASHP Midyear Clinical Meeting 2021 is virtual this year. It is December 5th through 9th, so make sure you look at the dates and when the deadlines are, especially for early bird rates too, if you're going to participate in the Midyear Clinical Meeting this year. So those are just some of the brief topics I wanted to cover. I'm looking to potentially put some more detailed information on some of these topics. I know this was kind of a brief overview, but I had the slides available. I just wanted to go over a couple things, so hopefully you found some value in that. Again, if anyone has any other information, advice for students or residents, especially with the midyear clinical meeting coming up, please put that in the comments section. We'll try to reply. If you have any video requests or any other topics that you'd like us to present, please let us know in the comment section. So with that being said, thank you guys for taking the time to listen. Please like, share, and subscribe, and we'll catch you in the next video.